Hello, in this video I will be comparing herpes to friction burn, genital herpes to genital friction burn, and I will let you know how doctors can tell the difference between those two common conditions. My name is Dr. Slava Fuzailov, and I'm the physician at STD Center, New York. One of the biggest and busiest STD clinics in Midtown Manhattan in New York City. So why people want to know the difference between genital herpes and genital friction burn? They're both very common conditions, and people of different genders and different ages can get those conditions. Both conditions can look alike when you looking at the skin, and people want to know how to differentiate between those two. But the most important reason why people want to know the difference is herpes is an infectious condition, and once you get the herpes virus, it stays with you and you can pass the infection to other people with symptoms and without symptoms, unlike obviously friction burn. So how doctors can tell the difference between friction burn and genital herpes? We usually take into consideration two parts. We'll look at the history of the rash, ask a lot of questions about the history of the rash, and examine the actual rash. 30 to 40% of the diagnosis come from the history of the rash, and 60 to 70% of the diagnosis come from the actual examination of the rash. The history of the rash consists of multiple parts. It's usually what's causing the rash, what's preceding the rash, incubation period of the rash, and if any other symptoms before the rash appearance. The visual exam of the rash, when we're examining the actual rash, we'll look at the location of the rash and the actual examination of the rash. So we're going to talk about each part and comparing two conditions to each other. Let's talk about the history of the rash. So 30 to 40% of the diagnosis, as I said earlier, comes from the history of the rash. So the history of the rash is what's causing the rash. Obviously, if we're talking about the genital herpes and genital friction burn, both conditions caused by sexual encounter, but people with friction burn usually remember having intense sexual encounter, prolonged sexual encounter, or not well lubricated partner. The friction burn is a mechanical damage of the skin, and that's why intense sex, not lubricated partner, prolonged sex, usually we think of friction burn rather than genital herpes. Number two is we're looking at the incubation period, and it's one of the most important part in differentiating steps between two conditions, herpes and friction burn. The friction burn has shorter incubation period from few hours to 12 hours. Incubation period is the interval between having triggering event or sexual activity and before seeing signs and symptoms. So for the friction burn is usually from 2 hours to 12 hours. For the herpes, the incubation period is much more prolonged. It's about, on average, is about 2 to 4 days. So longer incubation period for the herpes. Prodrome period is part of the history of the rash as well. Prodrome is what people usually feel prior to appearance of the rash. Prodrome period are usually non-specific systemic signs, and it's usually related to the herpes only. because friction burn usually does not have prodrome period, and those non-specific signs are fever, chills, fatigue, muscle aches, generalized weakness. So they called non-specific because other conditions such as flu, sinus infection, mononucleosis can give you the same non-specific symptoms. So prodrome period related only to the herpes. Friction burn, genital friction burn, does not have prodrome period. Now we're going to go to the visual examination of the rash. So visual exam of the rash, 60 to 70% of the diagnosis come from that, and it consists of two parts: location of the rash and actual examination of the rash. When we look at the location, when we're going to go into the location of the rash, the friction burn is a mechanical damage of the skin. Obviously, common sense, most commonly used areas for the friction burn usually get affected, and most commonly used and protruded areas. For the males, it's a shaft of the penis, side of the penis. For the females, it's a vagina opening and the vulva. And head of the penis for the males as well. Pubic area can be affected for the friction burn. For the genital herpes is caused by the herpes virus, and herpes virus prefer thin and moist skin. Why thin and moist skin? Because it's easier for the virus to penetrate the body through small cuts in that area. So people get microabrasions, or what we call microabrasions, with sexual activity, and herpes usually penetrate through those microabrasions, and it's usually more often in thin and moist areas. Obviously, thicker skin of the pubic area can get abrasions and you can have an outbreak there, but most common area for the herpes outbreak in males is shaft of the penis, the scrotum. In females is vulva and the vagina opening. When we're comparing both rashes, the herpes rash usually go from one stage to another. It evolves over time. First, you're gonna have tingling of the skin. The tingly skin gonna get red. The same red area is usually one big patch that gonna get multiple bumps. Those bumps gonna turn into sores. The roof of the blister comes off, you're gonna have an open sore, and then you're gonna have a crusted sore, and it heals without leaving any scars. So the herpes, the main differentiating factor goes from one stage to another. Multiple sores on the same red base, usually on one side, and the lymph nodes usually enlarged on the same side. For the friction burn, is usually small patch or large patch depending on the degree of damage. Usually the thin area, if it's involving the thin area of the skin, and most of the area in the genital area is a thin area, do not blister easily with a friction burn. That's why people with a friction burn do not see any blisters. They usually see a redness, irritation, and the degree of the irritation varies depending on the degree of the damage. If the damage is significant, it stays red, then eventually it becomes crusty and heals. But the swelling is minimal and no blistering. Herpes go from one stage to another. And the friction burn does not have any lymph node enlargement, and it usually localized infection. It's a localized lesion. This is a comparison for the herpes and friction burn. And now I'm going to turn to you, asking you if the video was helpful. And if it was helpful, we're going to ask you to click like button, support our channel by subscribing. Thank you.